So now we're going to talk about overcoming threats. So statistical conclusion validity is about identifying empirical relationships or correlations between the intervention and effect. A threat to this validity is a factor that can lead you to reach incorrect conclusions about a relationship in your observations. As mentioned earlier, the three most common types of threats to statistical conclusion validity are low statistical power, restriction of range, and unreliable implementation of a treatment. It's important that researchers minimize potential threats to strengthen the results of the study. The design of the study is also crucial, as well as the instruments used when attempting to minimize threats. In statistical conclusion validity, statistical power is key to addressing threats, which includes sample size, effect size, alpha level or significance level, and power. The researchers of this study used a moderate to large sample size as well as randomization when assigning participants to either the control or intervention group. Randomization is considered to be the most effective method when controlling confounding variables and improving reliability. Clear definitions of the two groups that were under investigation were also provided by the researchers as well. Clear descriptions of the interventions received by the intervention group really set that group apart from the control group. Both groups received equal time with their respective interventions and during their evaluation by the experts and simulated patients during their OCSEs. The duration of the empathy training for the intervention group was modest, but provided significant effect size, indicating that the correlation between the intervention and the outcome was significant with the intervention group. Effect size is important because it essentially means that despite the sample size, the intervention showed significant effects on the intervention group. In order to prevent alpha or statistical significance inflation, the researchers use multivariate analysis, which is a tool that helps to find patterns or relationships that are more complex and involve several different variables. And during the study, if the multivariate test was significant, univariate tests were then performed to evaluate significance. Univariate analysis tends to only look at one variable at a time, which can lead to incomplete conclusions. So using multivariate testing first helped us identify which correlations were significant. In order to avoid variance with the assessment of the participants' empathy levels by the evaluators, which included experts and the simulated patients, the researchers made each evaluator complete a 5-hour training on the empathy constructs and the rating instrument used for the study to ensure there was consistency with the assessment of the participants. Additionally, the evaluators were blind to which participants were in the control group versus the intervention group. Standardization of processes ensures reliability of data obtained. Internal consistency with the scoring from the simulated patients and the experts' questionnaires were 0.94 using the Cronbach alpha. Both the simulated patients and the experts' findings revealed that participants in the intervention group were significantly more empathetic than the control group. Both the multivariate and univariate analysis supported significantly higher empathy scores in the intervention group compared to the control group. Despite the researchers' best efforts, there were still limitations with this study, which included the semi-quantitative nature of the rating system, the simulated patients, and the experts used to evaluate the participants. Additionally, there were a limited amount of OSCE stations, which bring into question the student's reliability, there was limited amount of OCSEs stations, which bring into question the study's reliability and generalizability. However, the study demonstrates high statistical conclusion validity despite those limitations due to the strategies that we just discussed. Future studies are recommended and should include long-term follow-up to ensure that the effects of the interventions are not temporary. Thank you.